Welcome to our event on the future of virtual care. I'm Victoria Knight, healthcare policy reporter at Axios Pro. I'm coming to you from Washington, D.C. Welcome to our audiences on Facebook, YouTube, Twitter, LinkedIn, and on Axios.com. Join the conversation today on Twitter with @Axios and #Axios events. Over the next 30 minutes, I will be joined by my colleague, Caitlin Owens, and we'll explore the future of telehealth as the U.S. faces ongoing public health challenges. Our first guest is the representative from Illinois' 10th Congressional District, Congressman Brad Schneider, joining us from Washington, D.C. Thanks so much for being here today, Congressman.
Thank you.
So, Congressman, to start out, you've done quite a bit of work in the telehealth policy space. What made you interested in this policy area?
Well, one, we saw in the pandemic the impact that telehealth had, giving access to millions of Americans to healthcare that during the pandemic they otherwise would not have been able to get. I think it's not just during times of pandemic. We had a markup in Ways and Means where we're discussing a telehealth bill. And I had one representative from a city was talking about not having to sit in traffic when visiting a doctor. Someone else who was in a rural community was saying not having to travel hundreds of miles to visit your doctor. And someone else who represented a coastal community was saying a lot of his constituents are fishermen, not having to give up a day fishing for a 15-minute consult with the doctor. Telehealth opens the door to medicine to just so many Americans. It's something that we should be advancing as best as we can.
And what have you heard from your constituents specifically about how telehealth may have helped them?
I hear it everywhere I go. They talk about how during the pandemic they were able to talk with their doctor, have a consult. I've talked to people who even post-surgery now are able to check in with the doctor via telehealth, not have to go back and visit the doctor and make sure everything is proceeding as expected. Or if there's a problem, then they need to know whether they go to the doctor or to the hospital. And we're seeing folks in particular, for example, mental health, people able to have their meetings with their therapist. Some young people who might otherwise be uncomfortable going into a building, being seen going into a building, are able to have these conversations in a much more, as they say, you want to meet people where they are. They're able to have their conversations with their therapist where they are. So there's all kinds of benefits I'm hearing about talking to folks at home.
And you're a co-sponsor on the Telehealth Expansion Act of 2023. I think you mentioned it was recently reported favorably out of the Ways and Means Committee. And this bill would allow people with high deductible health plans and health savings accounts to access telehealth services permanently without having to meet their minimum deductible first. It's essentially a way to make a temporary telehealth flexibility permanent. Why is this something that you wanted to co-sponsor and work on?
This was a fairly straightforward decision for me because we've seen the benefits of telehealth, but I also know folks with high deductible health plans might be reluctant to have that meeting with their physician. So I want to make sure that they were able to have access to telemedicine without having financial constraints blocking it for them. So this was one, as you said, it's one step. There's other things we want to do. We want to make sure that the guardrails are in place so that people can't be taken advantage through telemedicine, but that everyone can access the benefits of telemedicine and their doctors can take care of them in the most effective and efficient ways possible.
And is there more telehealth legislation that you're wanting to put forward this Congress?
I think we're talking about a number of things, making it more accessible, helping make sure that physicians are able to utilize telehealth in a way that works for them and their patients. So we saw during the pandemic where we made decisions to make telehealth more accessible to people, how much telemedicine picked up. And I think before the pandemic, a lot of people maybe were interested, some were skeptical. I think now everyone's seeing the benefits. Folks support it, and then there are a few others who are even reached the point of evangelical.
And the Telehealth Expansion Act that we just mentioned, it has pretty equal bipartisan support on both sides of the aisle and in both chambers of Congress. Why do you think
Right.
telehealth is such a bipartisan issue? And it feels like maybe one of the areas of healthcare this Congress that both parties can agree on. Why do you think that is?
Yeah, I think there's a couple things. First, because of the pandemic and the experience folks had with telehealth, they see the applications, the way it provides quality, affordable care to patients where they are when they need it. But I think the second piece, I touched on it a moment ago, for different reasons in different places, whether you're in a big city, a rural community, or somewhere where it's just hard to get to the doctor, telehealth, telemedicine offers a pathway that provides healthcare, provides the quality care we need within the lifestyles that people are living. And different communities are going to face different challenges, but telehealth has a pathway to address challenges in all types of communities.
And how do you address, there are some GOP concerns about telehealth expansion having a high cost. There are some CBO estimates that, project that it could cost quite a bit to permanently extend certain things. How do you talk about that?
Well, I look at some things where people look at or look at a cup half full versus half empty versus half full. The other way may be just penny wise and pound foolish. I think if you look at where we've seen the benefits in telehealth, you're seeing physicians who are prescribing medicine, for an example, being able to use telehealth to improve compliance with the prescription instructions, which improve outcomes, which ultimately lower the cost of care. I think that the ability, for example, someone after surgery to check in with their physician, whether there's a question or a concern that oftentimes can be addressed just through a quick conversation and a telehealth visit, versus having to travel all the way to the doctor or worse yet, going to an emergency room. On the other hand, if there is something that does need that emergency care, the doctor can say, go to the emergency room and get the care you need, again, improving outcomes. So if we look at the measure it by outcomes and the total cost of the system, I think in the long run, telehealth is going to be one of those things that will help us bring down the cost of healthcare in this country.
Yeah, and you mentioned that there are some things you're looking at working on in regards to telehealth. Do you see the Ways and Means Committee also doing more work on telehealth this Congress? Especially, it's obviously in control of Republicans right now.
Right, I hope so. I think there's opportunities, as you mentioned, what passed out of the committee last week had bipartisan support. I've worked with colleagues on both sides of the aisle. I think there's enthusiasm to take more positive steps to provide access to telemedicine to more people. So if we can find the will, there certainly is the way.
And can you explain how you view telehealth as improving health equity?
Great question. Again, there are places in this country, whether it's rural communities or there are healthcare deserts in our most populous cities, telehealth can provide a way to reach specialists, reach all kinds of healthcare providers that might not otherwise be accessible in the natural course of the day. But we got to make sure in all cases that we have the broadband capacity. Telehealth is wonderful, but if you don't have access to internet, broadband, you don't have the benefit of telehealth. So it's the combination of things that we're doing. And as you know, last year, or in the last Congress, the legislation we passed to get broadband out, $60 billion to help get broadband to more communities. We're seeing that as well. So it's a combination of things that we need to work to make sure people have access to the technology, but also access to the physicians. And that way, I think you'll see telehealth will make a big difference for years to come.
And I know you mentioned mental health, but what do you see as the future for telehealth? Are there certain areas where access could be expanded in regards to different medical areas?
Yeah, I think the obvious one is mental health. Is people who are speaking to a therapist can have their conversations via virtual conversations like you and I are having right now, and it can make a huge difference in people's lives, and they can access the care when they need it most. So I think that's one obvious area. But even some of the things that will say, well, what about that? But someone has heart surgery, you're not going to do heart surgery via telemedicine. But the follow-up conversations, the check-ins, the cardiotherapy can all be supplemented and reinforced through telemedicine. So it really runs the gamut. There are so many different things we can do. And I think in the future, there may be new areas of medicine, nutrition, other things that telemedicine may be perfectly positioned to have a really positive impact.
This has been such a great conversation. Thank you so much, Representative Schneider, for joining Axios. We appreciate it.
Victoria, thank you.
And next, we have a View from the Top segment with Chris Freites.
Hey, thanks, Victoria. And thank you to our sponsor, Telehealth Health, for making this conversation possible. And joining me now is the CEO of Telehealth Health, Jason Gorvic. Jason, welcome to Axios.
Thanks, Chris. Happy to be here.
I'm excited to talk to you because as a leader in the virtual delivery of healthcare, I wonder, how's virtual care solving some of the thorniest and toughest challenges when it comes to healthcare?
You know, Teledoc Health and virtual care on a larger scale are really breaking new ground when it comes to improving patient outcomes, reducing the cost of care, and delivering a better consumer experience. And we can do that because we can harness the power of data to be able to deliver a more personalized healthcare experience and ultimately really more personalized quality care, because at the root of it, we can bring multiple services and clinical capabilities together that leverage a common data set. And we can do it across multiple clinical capabilities ranging from mental health to physical health, from chronic care to episodic care, and do it now in a fully longitudinal way so that virtual care is the front door to the healthcare system for many people.
I think that's amazing. And I wonder how it gets at one of the toughest problems we have as a society, which is, chronic disease. In fact, more than half of US adults have at least one chronic disease. We're talking diabetes, heart disease, obesity, really tough, thorny issues. And I wonder, how can virtual care help that growing burden on the healthcare system?
I talk about virtual care frequently as being one of the great equalizers in the healthcare system. Over half of our chronic care members live in underserved communities where they just wouldn't have access to the best care that's available. And we're now seeing more and more people engage with our virtual primary care, Primary 360. P360 is doing a great job of doing early identification of people living with chronic conditions. 1 in 3 members who are in our P360 program who have diabetes were newly diagnosed through the virtual visit. And 1 in 4 who have hypertension were newly diagnosed through that virtual visit. We're now seeing that translate to efficacy, where over half of our members in P360 who have a hypertension situation are actually lowering their blood pressure, and we're seeing those clinical outcomes that I talk about really manifest themselves because of the frequency of interaction and personalized healthcare that's delivered for them. So we continue to expand the scope of our services, and we'll continue to do that.
Yeah, you make a great point about how much care is being delivered virtually. I think we've all gotten used to that after the pandemic. So I wonder, how has your health plans expectations changed? The health plans that you serve, for example, Medicare Advantage plans, how are they relying on a service like Teledoc Health?
Yeah, I think historically, if you go back 5 years, health plans are really looking to us for virtual urgent care, essentially a narrow set of services that are more like point solutions. And then as they started to embrace other chronic care solutions, they began to understand the possibility of what we talk about when we talk about whole person care. So now for Medicare Advantage plans, for commercial populations, for Medicaid populations, they're looking for us to bring the full suite of virtual care services such that we can be the entry point and the solution for a broad set of clinical conditions for those populations. And because of that, and because of the efficacy of those things, we're entering into much more value-based arrangements with those health plans.
That's fascinating to me, that the growth around serving the entire person. And I wonder, as the CEO of a big virtual healthcare company, what do you see as the biggest misunderstanding that people have about virtual care?
I think people think that virtual care is virtual only, And we really see ourselves as being not only a deliverer of great care, but also a navigator for the consumer, such that we can get them the care they need, whether it's virtually in their home or in a physician's office, because they really need hands-on specialty care. And so we see ourselves as being the guide for the consumer across all of their healthcare. So for example, if we have a P360 member who needs a mammogram, we're going to refer them into the physical delivery system. And it doesn't mean that we're not there for them throughout the longitudinal journey of their healthcare. In fact, we're seeing greater screening rates for those people in need of those things than brick and mortar care, because we're able to use that data, be there with them on a regular basis, day in and day out, as opposed to only when they make the journey to the healthcare system. So we really see ourselves playing that role across the entirety of their healthcare needs.
And it makes a lot of sense because it's so much easier to access the care virtually that you would be there more often. It's a less of a burden to get through. So that makes a lot of sense to me. I wonder, finally, we have just about a minute left here. And you've talked a lot about the fact that healthcare doesn't need disruption. It needs to be transformed. And I wonder, what's the difference?
Yeah, I just don't think that the healthcare system is disruptible. It's too complex. It's too fragmented. It's too ubiquitous to be really disrupted. I also don't think it should be. I think it needs transformation. I think we need to think about the consumer differently and come to the consumer on their terms and leverage all of the capabilities that are available in order to deliver the best care, whether those are devices that are connected and constantly providing feedback for the consumer, or whether that's a really expert specialist who's intervening with that consumer to titrate their medications and make sure that their insulin is exactly what they need. So I think that is the possibility for transforming as opposed to disrupting.
All right, well, we have to leave it there. Jason Gorvic is the CEO of Teledoc Health. Jason, thanks so much for joining Axios.
Thanks, Chris.
And now over to Axios' senior policy reporter, Caitlin Owens. Caitlin?
Thanks, Chris. I'm Caitlin Owen, senior policy reporter at Axios. Our final guest is the president of the American Medical Association, Dr. Jeffy Ehrenfeld. Thanks for joining us today.
Thanks for having me, Caitlin. Appreciate it.
Congratulations on your new role. And before we hop into talking about virtual care specifically, I would just love for you to talk a little bit about what are your top priorities as the brand new president of the AMA.
Well, there's a lot to work on. We've been through so much over these past 3 years with the pandemic, and the AMA has put forward a recovery plan for America's physicians that we are driving forward to make sure that we have the healthcare system that we need, that physicians are able to practice in. And a big component of that is obviously our work in telehealth, the topic of today.
Yeah. And so, I think we've heard a lot over the past few years about how telehealth can be beneficial to patients. How can it be beneficial, or can it be beneficial to providers and the issues that providers face?
Well, it's clear to me that telehealth is critical to the future of healthcare, and that's why the AMA has been so aggressive in all of our advocacy and our policy work to expand telehealth access, as well as resources for physicians to be able to integrate these tools. The reason that it's so important, not just for patients, patients love it, right? Who doesn't like not having to drive 2 hours to go to a facility to have a 10-minute appointment? People love that. But it's so important for physicians because it's a key way that we can make sure that practices are sustainable and we can start to rejoice some of the we can bring back some of the joy in medicine, which is a challenge because there's so many administrative obstacles and hassles that physicians experience today. And telehealth digital tools are one way that we can make it easier for physicians to practice medicine across the country.
I think one of the largest problems that the healthcare system is facing is a workforce shortage. Providers, nurses across the spectrum. Does telehealth help address that issue?
It can, and certainly one of the reasons that telehealth was so important during the pandemic was we had so many patients in different parts of the country where access is a challenge, where suddenly we were able to use these tools, really made possible by the swift implementation at the state and federal level to expand telehealth access for patients. And so we want to make sure that physicians have the tools, the technology to seamlessly integrate these tools into their practices. We want to make sure that we de-risk that from a financial standpoint. We think that patients should have the opportunity to access these services from the privacy and the comfort of their homes wherever they live. The great thing is that telehealth isn't just about access. We see it as a really, really important tool to address some of the long-standing challenges around health inequities, particularly among marginalized communities. But unfortunately, the circumstances that impact inequities have to be addressed. So we look at things like gaps in broadband infrastructure. There are real issues around lack of affordable internet connectivity, as well as just having the devices, the necessary tech to get online, as well as some of the gaps in digital literacy around patients. So we have to work on all these things to make sure that telehealth lives up to the promise that we think it can, to not just improve access to patients across the country, but also to work on some of these equity issues.
Right. And so, we all kind of got used to telehealth during the pandemic. There was a lot of changes made really rapidly, and it really accelerated the use of telehealth. Flash forward 3 years, and here we are today. What are some of those changes that have been made permanent versus ones that you are pushing for to become kind of a permanent part of life going forward?
Yeah, well, it's important that we maintain coverage for telehealth services because, again, there's so much opportunity to improve access for lots of communities, but we don't have today permanent telehealth coverage. So the current insurance coverage at the federal level is scheduled to end December 31st of 2024. And so that's why we're pushing very aggressively. The Connect Act, Connect for Health, was just introduced on June 15th in the House and the Senate. Bipartisan bill that we've been working on. It's got the support of 60 senators, Democrats and Republicans. 150 healthcare organizations have supported this. It would permanently get rid of the geographic restrictions on telehealth services, expand originating sites to include the home, permanently allow health centers, permanently allow rural health clinics to provide telehealth services, allow more eligible healthcare professionals to utilize telehealth services, get rid of unnecessary in-person visit requirements for telemental health services, and basically allow the waiver that we've been operating under during the public health emergency to continue. So we know that this is a really, really important bill. We're hopeful and optimistic that it can get through. Obviously, it needs to be paid for, but we've seen that over the last 3 years, telehealth is just such an indispensable tool to get patients the care that we need, and so we're optimistic that we can get this over the finish line.
When you talked about the pay for, let me let you weigh in on this debate. It seems like the jury is still out about whether telehealth saves money overall, or whether it opens the doors to care enough that it increases cost. And opening the doors to care obviously isn't a bad thing, but Congress has to think about how to pay for all of that. What does the evidence say, and what is your argument for whether how a telehealth impacts costs, and then how to think about that impact?
Well, we know that the costs are worth it, and physicians, patients have better outcomes when they have access to this as a part of what's in their tool. But physicians see a definite advantage in these tools. We have a lot of digital health research that we've done at the AMA, nationally representative surveys in partnership with another organization. And what we see is that the percentage of physicians who see an advantage for patient care, specifically better outcomes, better access, that has continued to grow year after year after year. Those numbers were in like the low 80s in 2016. It's above 90% today. And that is respective of the physician's gender, their specialty type, their geography, where they have to practice. People know that patients get better care when these tools are an option for them. And so we know that they are an important thing that we have to maintain going forward. Patients want them, physicians find them useful, and patients ultimately do better.
Right. And so the other thing about where we are today is we kind of have the benefit of 3 years of experience using this expanded telehealth. What are some of the lessons you would learn, and what are some of the recommendations you would have for fine-tuning some of the policies that we've seen over the last few years?
Well, use has exploded, right? The percentage of physicians using telehealth, it was like 14% in 2016. It was 80% in 2022. People are excited about it. We have to make sure that we codify not just the coverage and the payment and the access issues, but also we have to make sure that the services are comparable to the services that are provided in person. So that's why getting rid of the originating site geographic restrictions is important. But insurers also ought to allow all contracted physicians to provide care via telehealth. Telehealth has become integrated into physician practices, and so unfortunately, we're starting to see the perpetuation of separate telehealth networks. That is not justified. It's confusing. It's confusing to patients. It threatens continuity of care and the physician-patient relationship. And so we shouldn't allow that to happen. We shouldn't have cost sharing used as a tool to incentivize care from certain providers. So reducing cost sharing for select telehealth providers who don't provide in-person care inappropriately is steering patients away from their current physicians, leading to fragmentation of healthcare system and threatening continuity of care. So we can't allow those things to happen. That's an important lesson that we have learned over these past 3 years, and obviously a policy objective for the AMA.
Separate telehealth networks. That's interesting. I hadn't heard of that before. So can you say a little bit more about what that means?
Well, telehealth should be a supplement to, not a replacement for, in-person provider networks. Patients should always have the opportunity to access care in person if they choose. It should be the patient's choice.
Right. And so we're going to end this today with a topic that is on everyone's mind, whether you're in healthcare or not. It's hard to talk about technology without talking about AI. How does AI factor into this conversation about virtual care?
Well, it's clear to me that AI is going to be such an important tool for physicians moving forward, and we're only starting to scratch the surface of what's possible. There's so many places where AI can help remove some of the inefficiencies, make documentation more streamlined, make it easier for us to actually administer the work that we do day in and day out. And I look forward to that day. AI is not going to replace physicians, but physicians who use AI will replace those who don't.
And are there any parts of AI that concern you? Or is there anything that we should be watching out for?
Well, it's really important that there's transparency around the use of these tools. You can only supervise, you can only correct, you can only recognize if there's a problem if you know the AI is there. And we have seen colossal failures in other industries where AI was built into a system, people didn't know about it and then couldn't correct it, and led to some really terrible examples. The best example I can give you is the Boeing 737 MAX crash. A new safety system, an AI system built into a plane that the pilots weren't told about. It wasn't in the operations manuals. There was no training for the pilots. We can't allow that to happen in healthcare. We can't repeat that mistake. When we build AI into a medical device, into a system, into software, into electronic health record, we've got to make sure that the people in those workflows understand it. They know that it's there and they can deal with it when it's not working.
Well, there's a lot more that we could talk about on this subject, but unfortunately we are out of time. Dr. Ehrenfeld, thank you so much for joining us, and congratulations again on your new role.
Thanks for having me. Appreciate it.
Thank you all for joining us this afternoon for another virtual conversation that has made everyone smarter, faster. For more information or to sign up for the Axios Vitals newsletter, visit axios.com/newsletters or the Axios app. Thank you all for joining, and we'll see you on axios.com.